We are going live. All right. Hello, everybody. My name is Jordan. I use he, him pronouns, and I am a queer
We are
speech
going live.
and gender affirming voice coach. Today, I will be interviewing my friend and colleague, Hannah Higgins. Hannah, would you like to introduce yourself?
Yeah. Hi, everyone. My name's Hannah Higgins. My pronouns are she, her, and I'm a licensed clinical social worker.
Cool. So today we are going to be having a conversation around masking and mental health. And so this conversation was actually inspired a couple weeks ago. I had a client that asked if I worked with how many clients that I work with are neurodivergent, and I would say about a third of the clients on my caseload are neurodivergent. And for those of you who don't know, my entire practice is dedicated to working with trans and GNC folks, youth and adults. And so at any given point, about 30%, even 40% of my clients are neurodivergent. And so shortly after, I had a conversation with Hannah, and we were talking about masking and neurodiversity, and I thought you would be an awesome person to have a conversation about this with. So Hannah, to start off, can you talk a little bit about your experience with working with youth and adults who are neurodivergent?
Yeah. Well, first, thanks so much just for reaching out and allowing us to discuss this topic. I'm very passionate about it. But as a neurodivergent person myself, I grew up noticing a lot of shame, a lot of ableism within the different systems that I navigated, especially the public school system. So as I kind of naturally through that became a school social worker, I became more and more passionate around becoming an advocate and being an advocate for neurodivergent students, knowing there's this huge gap and misunderstanding around support. So first and foremost, I feel like I am a student advocate. And then that has allowed me to also create a private practice around supporting neurodivergent people from a neurodivergent affirming approach.
It's amazing. What do you think it means to be a neurodivergent affirming therapist or a neurodivergent affirming healthcare provider?
Yeah. So first of all, just to define kind of just what neurodivergent and neurodiversity is and how that kind of goes into it. Neurodiversity or neurodivergence really just means like neurological differences. And so I think of it almost as how the brain neurologically like deviates from kind of that standard typical norm that society has socially constructed. And so we can see this as a strength. Neurodiversity is positive for the human environment. We want that. It's not, yay, I'm a neurodivergent because I have trauma, but it's recognizing that neurodiversity and having differences is a strength for society. And so a lot of it is advocating with that, but that is what neurodiversity means. And so what I do with my work is instead of trying to fix neurodiversity, often when we think of neurodiversity or being neurodivergent, we think of autism, ADHD, maybe trauma, OCD. And instead of kind of following this pathologizing approach towards fixing it and seeing it as a problem, it's how do we embrace this? How do we use our strengths? How do we see some of our challenges as even potential strengths instead of this kind of negative narrative? And so,
I completely agree with what you're saying. And as a speech language pathologist who worked in school-based settings, I had to do so much unlearning because at the time I didn't realize that some of the methods that I was implementing and learning, like whole body listening, was actually like teaching kids how to mask and how to suppress their stims and how to, act like the norm or act like their same age peers. And so just learning from people who are autistic and neurodivergent and being able to kind of change the approach, because my thing is I don't want to teach my clients how to mask. And we'll talk, I think it's important we talk a little bit about like what masking is and like the effects that masking has. And so, yeah, it's been, for me, I've had to do a lot of, I guess, unlearning and being able to support my clients.
Yeah, I feel like, I mean, I constantly am still having to unlearn a lot of different things and just learning as I go. But I agree, ultimately connecting with the community, being part of the community rather than seeing how do we fix this is
Mhm.
ultimately, yeah. So what masking is, and how I kind of see masking is it's ultimately a coping strategy. So we mask to cope with the social demands within our society that are so overwhelming or are so kind of exhausting, actually. And so it can start at an early age, these systems such as the public school system, even, our parents at home potentially. We're getting messages about how we need to change or fix or hide certain traits about who we are because they're not seen as either socially acceptable, they're not seen as typical. So even if they're not harmful, we're being told by society to hide these parts of who we are. And when we're having to do that, especially throughout, long durations or throughout our whole life, that can really cause some mental health implications and really impact our identity and self-esteem.
That sounds exhausting to have to do like all the time. Can you talk about a little bit of like I guess the effects of masking all the time, or the effects that you see not only maybe in yourself but in the clients that you work with?
Yeah, I unfortunately myself do struggle with masking and feeling like it has um, been like a survival mechanism for me in the past. And I'm having to even unlearn and kind of take my mask off more and more and learn how do I advocate for myself and give myself that self-care, especially as a therapist. The mental health implications can really be really rooted with trauma and identity. It can cause anxiety and depression. So navigating these spaces, do I feel safe here? That can be very like anxiety inducing, and then can also lead to trauma when we can't predict the environments that we're navigating. And then I also would want to address just the theme of intersectionality with as a white cis female person, I can't speak on other people's experiences, but from even my own point of privilege, though, I want to acknowledge that and talk about how there's lots of layers to this too. So we may feel like we have to mask due to our race or our culture, our religion. We may feel like we have to mask due to our sexuality. Our gender, different, these are all kind of different aspects where we're having to mask in different social spaces or different environments. And so just thinking about how this can kind of all add up and how it layers and how all of those themes can impact one's mental health differently.
Yeah, I've had some clients that I've worked with recently that have talked about the like mental implications of having to mask and how it's exhausting. And so as a service provider that works with a lot of neurodivergent folks, I try to incorporate strategies to help them connect kind of mind, body, breath in a way that feels safe and affirming for them. And so I'm curious, like about any ideas that you might have as well. But something that I really enjoy incorporating in my sessions with clients is a lot of breath work. So breathing exercises, and then I am kind of a nerd about polyvagal theory. So really helping clients to, understand their nervous system, how it functions when they're feeling in that like ventral vagal state of like I am safe, connected, calm, versus sympathetic where it's like I'm in danger, versus when they're shut down completely in the dorsal vagal state, and being able to help them understand that it's not, and not making it super complicated for them, but very easily helping them identify what nervous system states they're in and strategies to kind of regulate between the three, because we're not going to be like all the time like good vibes, like I'm feeling safe and centered, especially being a part of a marginalized group. Because for example, if you're walking for somebody that is, cis, they might not have to worry about walking out their door and getting and ordering a cup of coffee. But for somebody that's trans or GNC, or in another marginalized group, they might be in a constant state of sympathetic nervous system activation at all times. And so how can we work with our clients to kind of help get them out of sympathetic nervous system when we live in a world that literally puts these people in sympathetic nervous system states all the time? So I'd love to get your input on that.
Well, first of all, yay, shout out to polyvagal theory. And then also, like what you're describing is how to use this affirming approach where we're not just seeing it as anxiety or just the fight or flight concept. We're understanding all of the different layers. We're understanding society's role, and we're validating and affirming the client first and foremost from that standpoint, and building that trust and rapport. And being realistic is ultimately part of being affirming, I feel like. And so what I would do, yes, with the deep breathing, very much when I think of polyvagal, I'm thinking of noticing our triggers, noticing those states without judgment, and kind of having a plan for what works for us. And I think that there's kind of these basic or typical ideas of what can help even stimulate the polyvagal nerve, or what can be kind of seen as typical coping strategies. And when you're neurodivergent, your coping strategies may not look typical. You can still access all of these tools, all of these strategies. It just may look differently. But one thing I would suggest is how we do our deep breathing. I really am a firm believer of big deep breath in through your nose and then breathing out your mouth for as long as possible. Taking care of your basic needs, like making sure you're drinking water, and those kinds of things. And having kind of that coping plan for what is realistic, what is possible. Finding spaces that do feel safe. So being able to identify community or spaces that do feel good so that you can practice taking off that mask. So just even thinking what could support with like self-care and masking, and the anxiety associated, it's finding those helpful spaces, to kind of practice being yourself. But yep, I would say deep breathing, ultimately validating yourself for what you're going through as well, while still having a plan to feel safe.
Yeah, I think when kind of talking about like safe spaces and kind of getting prepared for those different things, something that I like to work on with clients is helping them use their affirmed voice in our sessions, where I'll be like from different scenarios. So one scenario might be like, hi, what can I get started for you? My name's, like pretending to be a waiter at a restaurant, or being the barista at a coffee shop, and having them use their voice and their communication patterns with me first as a way to prepare their nervous system. But I'm not like, use this script, like this is how like what you're supposed to say, because my thing is like, I want to help guide my clients in being authentically themselves, you know, without telling them how to mask. But I know there might be appropriate times, I guess, for people to mask. For example, like a job interview or when they are meeting with a, I don't know, a new group. Do you feel like, I don't know, in your perspective that there are certain times where people should be masking, or should we be advocating as healthcare providers or coaches that are working with the community to always, like, it's important to learn how to take off the mask? I would love your input on that.
I think the unfortunate reality of our society is that like kind of that code switching theme that they call of like when you're in an interview, you might want to be prepared to talk this way. These topics might come up and it kind of goes from there. And I think I would like us to get to a place where we can't, and I do try to advocate for this. And I think it would be nice if we could collectively come to a place to kind of change a lot of those ways. I know some like businesses, I think, could like virtual interviews or different, there's kind of some different ways to accommodate, but there's nowhere near enough support around just how to support those type of experiences. And my thing is, if your behaviors or your ways of being are not harmful, you should be able to be yourself. So that's just kind of where I stand ultimately on that.
That's really, I really like that a lot. Like, you should be able to just, how do you, I guess, can you talk a little bit about your work with clients a little bit, either youth or adults, and ways or strategies that just like telling them that you can help them feel more affirmed and empowered, that they don't need, letting people know that there's nothing wrong with them and that they don't need to be like fixed or cured of anything. So I'd love to just hear more about your work with
Yeah.
that.
Well, with a lot of the students I work with and clients, it is ultimately, it can be about self-exploration. Do they want to explore more about themselves and their identity? How could I support them in exploring the different parts of them and their identity? How can I support with the self-care, or what do they want is ultimately how I do my work, is what do they want and how would they like that to look? And then I think of it as my job to accommodate that and using my creativity to do so even. And that's given me the ultimate, connection and the reward for what, the rewarding experience for what I do. But I'm meeting with students, I'm meeting with clients. If they're describing the stressors of masking, something I really would focus on too is, are your accommodations happening? Do you have a 504 plan? Are there do you already have accommodations in place? Do you need accommodations, whether that's school or work? But I think as therapists, a lot of time we think talk therapy or this, what's what's helpful, and thinking of therapeutic approaches, but a lot of times it's advocacy around navigating these systems. If we are able to have accommodations, we may not have to be pushing ourselves as hard and masking and then leading to burnout,
Mm.
hiding who we are to the point of a mental breakdown, and then having to take a bunch of work off anyways. Having a preventative way to advocate for who we are and have our rights in place and implemented is a big focus for me.
How would somebody, so I get at a school where they're hopefully the teachers, social workers, SLPs, professionals are doing hopefully the advocating at school and accommodations for people at school. But what about work? Somebody in, like, I don't know, in their adulthood and they are working wherever that is, whether it is at a cafe or a corporate job. How would someone go about, one, what are the implications of telling your employer that you're neurodivergent? And two, how would somebody go about asking for accommodations or talking about that if they were feeling burnout, or if they were feeling like they were having to mask all the time at work? What do you have any recommendations for what
Yeah.
more of the adults should do?
Maybe hypothetically kind of just problem solving, even of like, what are the options? Is this job, like, do we really want this job? Is it the best fit? Is that even an option? Like exploring even that, if that's something they're thinking about or open to. But then if they need a 504 plan, and they don't already like have one through school, and they're realizing like, oh my gosh, I need help, I need accommodations. You can make an appointment with a doctor. You can make an appointment with your therapist and then begin explaining how you are looking to get a 504 plan for accommodations. And then you would work with your doctor and or therapist to develop a 504 plan that has work accommodations for you based on your disability or based on just kind of the challenges associated. And then it is a risk to communicate these things. You have your choice if you want to disclose it or not. I feel like I do have to own, I feel like I have the privilege. I work within special education. And once again, being like a white cis female, I feel like I do have some privilege, and I get to kind of take my mask off freely at times. And I do get to rep who I am pretty openly. My job, I feel like, will always be in demand, and things like that with just how that goes. And so I do get to sometimes live fearlessly at work and be who I am. But I still do get triggered with a lot of themes at work as well. And so having conversations with your boss preventatively is going to be the most helpful when you have accommodations, letting them know in advance. If you feel comfortable doing that. And that's something you could discuss with a therapist. Even I feel like an SLP could help with some of just this. How do you communicate from a self-advocacy standpoint? The conversations can be helpful. I've had to do that in the past, and there's been times it hasn't worked well, and there's been times it's worked really well. So sometimes it is kind of that risk we unfortunately have to take, and that shouldn't be our inconvenience. We shouldn't have to exhaust ourselves just to get what we need. But when we are open about who we are, we can be met with some kindness and people that will be open-minded and accommodating as well.
Totally. Thank you for that. That's super helpful, especially because, this affects not only youth, but adults as well. So super important to know how to navigate it. Or if somebody didn't receive services as a kid and they're an adult and they were late diagnosed and they're, needing to figure out how to navigate. And some people don't know what a
Oh, and that
405.
would be masking. That's masking.
Mhm.
Honestly, a lot of that's a theme around masking as well. So I love that you brought that up, because that does directly relate with masking. A lot of adults of all ages kind of survived their childhood. They survived public school by pushing themselves or masking and putting up with these demands. And now they're in the working world and trying to, we're trying to navigate this capitalist society, whether we're diagnosed or undiagnosed or self-diagnosed. And then we're like wanting those accommodations, but did not have them early on because we weren't identified then, because we were masking
Yeah.
potentially. And then it leads to that burnout where it's like, I can't imagine maintaining a job without having some kind of accommodation.
Yeah, so can you get for people listening that aren't familiar with the 504 plan, can you elaborate a little bit on that? And especially because can you get a 504 plan as an adult, like after as an adult, say you never had services
Yep.
as a kid, you're masking, and then you're in your 20s, 30s, 40s, whatever it is, you're working and you're like, I need accommodation. So you can get those as
A
an adult?
doctor. Yep.
Okay.
A doctor, a psychiatrist. I think mental health providers could support with initiating one. Ultimately, doctors, psychiatrists can help. An example, even like something 504s aren't even just for like mental health related or neurodivergent, but it could be like you could get on a 504 temporarily for a broken leg even. So that's why I think of how you bring it up with your doctor for during COVID. I have rheumatoid arthritis as well, and I had communicated with my doctor, and they wrote me a letterhead that was used, and I would give that to HR, and that was used where it was maybe not like 504 plan, but that letterhead, that document was used to give me accommodations that I had created with human resources, with some input from my boss within the school building I worked at. And so that's just kind of even like a very basic way a 504 plan or accommodations can work, based on having a medical diagnosis or disability. And then if you don't have a diagnosis already, then I would start exploring that even with with a therapist of I am exhausted, I am experiencing burnout, just getting through day to day, just maintaining a job. I really need accommodations. And I believe they would be able to support someone through that process towards a 504. But if you are an adult and you are like, I just got diagnosed with ADHD, I've been done with school for a long time, what do I do to get accommodations in the workplace? You can talk to your doctor as a start if that's available.
What if that's not available for people? Like, what if they don't have access to a therapist or
There,
access to a doctor?
yeah, we would want to try to find a way to connect with community resources. Um, Otherwise, I mean, trying to communicate with HR. Sometimes you can have accommodations met without a 504 plan. The 504 plan, just to also, I forgot to explain what that is. So the 504 plan is a legal document that can give you accommodations within the workplace, or at school or within those kind of systems. And they're accommodations, they're not services. And so that is through the ADA, the American Disabilities Act. And people, like, we have the right for our 504 plan to be implemented and followed and have the accommodations, but it can get very messy legally. But sometimes you can, without a 504 plan, talk about these concerns or these challenges and have accommodations if your boss is willing to work with you. And that's why I do say communicate about it. Either way, at school, some teachers and classrooms or just school buildings in general have a culture where you don't need to have this official document for us to accommodate you. That's something I really stand by as well. And so it's hard. I really want to say if you're connecting with community agencies could also really help you with services in general, especially with like Social Security, Medicaid, starting with like a community agency.
Cool. Awesome. Is there anything else that you wanted to bring up or talk about before we wrap up? It was like anything else that you might want to talk about?
No, I think that's pretty much everything for now. I can always talk on and on about this,
Yeah,
but
yeah, no, it's amazing. Hannah, can you talk a little bit more about how people can find you if they're
yeah.
interested in learning more?
Yeah, I was going to say, if you're interested in just learning more about what I do or just connecting with me more, I really recommend checking out my Instagram handle. It's Hannah Rose Therapy dot LCSW. So at Hannah Rose Therapy dot LCSW. And we can maybe post that in the comments or something. but I have tons of posts about all my values, kind of some of the work I do, so you can learn more, be connected with the neurodivergent community, and all that.
Sounds good. Hannah, thank you so much. I appreciate it so much. It was such an amazing time getting to chat with you. So thanks for sharing your knowledge and wisdom with us.
Yeah, thank you so much for the opportunity.
All right, I'll talk to you soon.